citizens all over the world, living, communicating, taking action, and creating impact in our communities. JCI is a non-profit organization of young active citizens aged 18 to 40 who are engaged and committed to creating impact in their communities. Active citizens are individuals invested in the future of our world. JCI gathers citizens from all sectors of society. We develop the skills, knowledge, and understanding to make informed decisions and take action. As globally minded young people, we all have rights, responsibilities, and shared goals. We find targeted solutions to local issues benefiting our communities, our world, and our future. Embracing new ideas, collaboration, and diversity, we have the passion and courage to address the critical challenges of our time.
My name is Shegun Motosho, JCI Uyo City 2021 President. Yeah, we're here today for free medical outreach, which is one of the mission of Junior Chamber International. Junior Chamber International's mission is to provide development opportunity for young people to create positive change, which is what we're doing here. One of the things we do is to add value to ourselves and to the community at large. Health is wealth, and which is one of the reasons we came up with this program to help people who are not too financially okay to go to the hospital. We could do it for free. We're doing it for free, and we're having good number of people. We partnered with Neon Health Services, Medical Laboratory Association of Nigeria, Akwa Ibom State Chapter, and Alpha Vision International High Center.
My name is Dr. Loveday Ndubisi. I represent Alpha Vision International Eye Center, and we are an indigenous eye care service provider here in Akwa Ibom State. We are partners with Junior Chambers International, that's JCI. They have been able to put together different sectors of health care practitioners, doctors in different specialties, and then also people from the community have come around to have their general health checked. For us here at Alpha Vision, we have taken care of the eye health of the people that have come out here.
My name is Emilia Eliezer. I'm right now the chairman of Association of Medical Laboratory Scientists of Nigeria, Akwa Ibom State Branch. And we are here today for this program, partnering with JCI Uyo City and Neon Specialist Hospital, and we're housed in G-Line.
This is a collaboration with JCI Uyo. So I came to give a message on COVID-19 and vaccination for COVID-19 in Nigeria generally. So COVID-19 has come to stay with us for, at least for some time now. So of course we don't need to do away with all the preventive measures that government has told us to do all this while. To keep doing our face masks, social distancing, and then avoiding crowded places. And then as much as possible for people who are eligible, to register with government agency and get a vaccine, because the vaccines have been shown to be safe and effective in preventing especially the severe forms of the disease. So for people as much as people who are eligible, people who are a bit older, people who are health workers, people who like work with crowds, people who work with the public, should register and get vaccinated. And then for others, even those who have not been vaccinated yet, eventually the vaccines will be available for everybody. For now, people should just continue with the safety measures. The case numbers are coming down now, but we don't want them to go higher subsequently. So people should still continue with the safety measures they've always been doing long before now.
I came to give a talk on the skin, specifically hazards of skin bleaching. Skin bleaching, like we all know, is quite rampant in this part of the world. A lot of people apply substances on their skin to make it look brighter or fairer. So skin bleaching is the application of substances, whether natural or artificial. And when I talk about artificial, there are chemicals that we apply on the skin to enhance fairness. So it comes in several names in our local parlance. Some people call it skin toning, skin glowing, skin brightening, skin lightening, skin whitening. I've mentioned like 5 or 6 synonyms for this same terminology called skin bleaching, and it's hazardous to the skin. God has already endowed us with melanin. Melanin is the natural pigment we have as black people or brown people. So it's a brown or black coloration of our skin that protects us from the harmful effects of the sun rays, the ultraviolet radiation coming from the sun. The radiation can penetrate into the skin and cause, at the worst, skin cancer. So skin bleaching, depending on which pathway it follows, prevents production and synthesis of melanin, which is the black pigment, like I mentioned. So this cream could numb or destroy melanocytes. These are cells that produce the pigment melanin, and in so doing, it comes with several complications.
Okay, the collaboration for today has really impacted a lot of people, because we got to realize that most times why people do not come to the clinic, they are looking at the cost. But here, JCI has brought it to the doorsteps of the people. So you're not paying consultation here. So it makes it easier for you to just walk in. Right now, the people in this vicinity do not have an excuse not to have an eye check, because the opportunity has come to them. We've attended to, I think, about 30 people. We've done referrals. We've given drugs to the people that needed drugs. Eye care is important. It's as important as breathing itself. It's one of those things we shouldn't just take for granted. Okay, so I can see from afar. I don't have headache. My vision is not blurry. And we just sit down. Eye checks are very important.
The World Health Organization says that 80% of blindness is preventable. But how can we do that? It is when you come to the clinic, when you visit an eye care service provider and have a proper eye check. That is when you will be able to prevent something that would have caused blindness. Discovered early, we will be able to prevent blindness from such. One of the reasons I've discovered why people don't go to the clinic or go for an eye check, really not a good reason, is because they think taking care of their eyes can be expensive. But I will send this message across to everybody. Blindness is more expensive than eye care. Take care of your eyes. You will avoid blindness. In the long run, you will spend less to take care of your eyes than what you would have spent should you go blind.
Now, what medical laboratory scientists is actually doing on this program and platform is we are carrying out tests as required by the medical doctor who is consulting, depending on what the patient's needs are.
The program has really helped. And now I can really say that I need glasses.
It has benefited so much because I've checked all my status, the malaria, they checked me of HIV, they checked me of blood, sperm counts and all having checked. They have done very, very good. The sky is their limit. They didn't keep it up to see that it helps souls.
It's been an interesting outing for us today. The first of its kind medical outreach. Today I had the opportunity of taking the temperatures of the people that came to ensure that they were healthy enough to be admitted into the environment, considering the fact that those are vital signs that medical personnel have advised that we use to detect and determine perhaps if some people have underlying symptoms of prevalent diseases. So I had the pleasure of using the thermometer, the infrared thermometer, to take the temperature, and it was a very interesting exercise. I could see the faces of the incoming beneficiaries smile when each time I told them, your temperature is 36.4, the temperature is 37, 35.1, or 2, or 3. And then, am I okay? Yes, you're okay. You can come in. It's been fun all the way, and I want to congratulate and commend the effort of JCI Uyo City. Humanitarian service is everything we live for. Our service to humanity is the best work of life.
Key that we were able to achieve what we plan to achieve. We've had good numbers of people from this community come out for this free medical outreach. We have doctors, good doctors attending to them, and before you know it, we did some certain tests. Then we've had health talk about cervical cancer, which it's one of the cancer that borders on women, and we felt we should take it as an opportunity to sensitize them about the cancer and tell them way forward. More or less like a health talk which was done by Dr. Adeyeye. We thank God and thank all the partners that this medical outreach is a success, and we're able to meet the need of the people, adding values to their health, because we believe health is very important and key to human life. I want to use this opportunity to appreciate Passion TV, Neon Medical Health Services, Medical Laboratory Association of Nigeria, Akwa Ibom State Chapter, Alpha Vision International High Center. My team, I must say this, you guys are wow. I am grateful to JCI Uyo City. I am grateful to JCI Nigeria. I'm grateful to JCI at large. Thank you.
Are you a young active citizen? Do you want to make a difference in your community? Join us on this journey of local action for global impact. Join any JCI local organization near you. If you are in Akwa Ibom State, please leave a comment below. We will get to you. JCI, be better.